A very good afternoon to all of you. Assalamualaikum warahmatullahi wabarakatuh. Excellencies, PPD Executive Committee members, Excellency PPD Board Member, Honorable Dr. Sulaiman Timios Kwidini, Deputy of Health and Child Care of the Government of Zimbabwe, as the chair of the session, Honorable Head of International Organizations, Honorable Partners, Country Coordinators or PCC of PPD member states, our high-level honorable panelists, the OIC PPD Secretariat, participant of the Inter-Ministerial Conference on SSTC, and distinguished guests, ladies and gentlemen. My name is Ukik Kusuma Kurniawan, representing on behalf of the PPD board member of the Government of Indonesia, the head of National Population and Family Planning Board of Indonesia. This is a great honor to be with you at this 21st Inter-Ministerial of SSTC in Population and Development today in Dhaka. Our government extends our gratitude to invite us to join this conference. Next slide, please. Yes. Excellencies, distinguished guests, ladies and gentlemen, the Cairo program, adopted in 1994 at the International Conference on Population and Development, and the Beijing Conference on Women in the year 1995, mark a fundamental turning points in the recognition of SRHR. SRHR are also largely addressed to in the Agenda 2030 in its 17 Sustainable Development Goals adopted in September 2015 by around 193 member states of the United Nations. For Indonesia, the SRHR encompasses sexual health, reproductive health, and reproductive rights, and reflect an increasing consensus on the services and intervention required to meet the sexual and reproductive health needs of all individuals. Over the past 3 decades, significant advances has been made in the SRHR landscape. However, there are still unfinished agenda that needs to be addressed, such as unsafe abortion, unmet need in family planning, maternal and neonatal deaths, cervical cancer, HIV and STIs, and gender-based violence on women and girls. Excellencies, ladies and gentlemen, in Indonesia, the right to reproductive health service is regulated by Indonesian law. This law guarantees that everyone has the right to obtain a safe, effective, and affordable reproductive health, including family planning services for eligible couples. Through concerted efforts that has been made, significant progress has been achieved for Indonesia. Within the period of 40 years, our total fertility rate declined from 5 to 6 to become 2.1 children per woman currently. Also, there has been a sharp increase of the contraceptive prevalence rate among married women, stands at 60.4%. Also, in the year 2022, the government passed the Sexual Violence Crime Law, making sexual violence punishable by law. And the median age at first marriage in Indonesia also has increased from 17 years old in the year 1991 to become 23 years old in the year 2017. Issue on elderly was also taken into account. And lastly, to targeting the young people, reproductive health is integrated into the school curricula, providing knowledge and awareness to adolescents on SRHR. Excellencies, distinguished guests, ladies and gentlemen, we believe that every country has their own policy and strategy to implement the SRHR that can be shared among other countries, especially among PPD member states, under the framework of South-South and triangular cooperation to improve the program implementation and the achievement of the ICPD program of action and SDGs, especially related to SRHR. In Indonesia, South-South cooperation has 4 objectives, which are, firstly, strengthening development cooperation among South-South countries. Second, partnership triangular cooperation. Thirdly, introducing Indonesia's best practices. And fourth, enhancing communication to solve global issues. We grouping this SSTC's activity under the 3 programs, namely first, development, second, economic, and third, the good governance. Concerning the importance of SRHR, therefore, one of the flagship programs in the Indonesia SSTC flagship is family planning, which includes also reproductive health with our office, the BKKBN, or National Population and Family Planning Board, Republic of Indonesia, as the implementer. BKKBN SSTC activities has been implemented through partnership with development partners, or in other words, with triangular cooperation. These development partners supporting BKKBN SSTC program, including bilateral or multilateral organizations, some of which are prominent SSTC players such as UNFPA, Indonesian Ministry of State Secretariat, and also Indonesian Aid. Therefore, the role and commitment of those partners toward the successful SSTC program is also very imperative. Excellencies, distinguished guests, ladies and gentlemen, for the SSTC program, Indonesia has developed 8 thematic training in 9 selected provinces as the Center of Excellence, COA, International Knowledge Hub, with related to improve the SRHR. The topic are, firstly, the quality of family village was attended by the government of Afghanistan. Second, training on supply chain management in contraception was attended by the government of the Philippines. Thirdly, training on adolescent RH was attended by the government of the Philippines. Fourthly, Muslim religious leader, now to become interfaith youth leader in family planning and RH, was attended by the government of Vietnam, Malaysia, and Myanmar. Training on microdata management in family census enumeration. And 6, training on postpartum family planning program was attended by the government of Kenya. 7, training on comprehensive family planning services attended by government of India and Pakistan. And lastly, the training on family planning and RH services in emergency situation will be participated by the government of Afghanistan. Indonesia also organized training that are tailor-made or demand-driven, in which the training tailored to the specific needs to the participant. Those all made Indonesia to win the United Nations Population Award in the year 2022. Excellencies, distinguished guests, ladies and gentlemen, in this important occasion, once again, please allow me to express the strong commitment of Indonesia, especially our institution BKKBN, in promoting South-South cooperation for acceleration of the achievement of the national, regional, and global goals and commitment. In closing, Indonesia, through our office BKKBN, reiterates the needs to strengthen and boost cooperation among countries, especially PPD member states, under the framework of South-South cooperation. We stand ready to advancing any collaboration through any MOU, and also to share best practices among developing countries, especially PPD member states, to address SRHR and to achieve the ICPD plan of action, SDGs, and also 3.0 with the support of UNFPA country offices. Excellencies, ladies and gentlemen, I thank you very much for the attention.